The human body is much more than a collection of flesh, bone, muscle, and fat. It can produce movement, it can ponder questions, it can feel excitement. It runs, rolls, flips, bends, and stretches. It experiences the myriad of moods, emotions, and feelings unbeknownst to tangible, inanimate objects. But unfortunately, the human body can also become unhealthy, undernourished, and overweight. And often depression and insecurities can accompany an unhealthy lifestyle. But thankfully, the human body has the potential to rejuvenate, even after long years of sedentary habits and nutrition-deficient food choices. With the proper education, motivation, and availability, anyone can cleanse their body of unhealthy decisions and learn to make good choices. And with a global focus on eating nutrient-packed foods and living active lifestyles, the many unhealthy bodies around the world can overcome malnutrition and become strong again.
So we were all originally attracted to the challenge on malnutrition, specifically obesity, because we saw that it really related to our everyday lives, just walking around school and just out in public. So I think I'm real glad we chose that challenge.
Yeah. I think so.
And we knew that in order to find a solution to improve nutrition in people's lives, that we needed to motivate them to make healthier lifestyle choices.
And we found through our research that financial incentives were usually the way to get the most significant weight loss.
But at the same time, we didn't really want to make people just motivated by money. We wanted them to be motivated to actually get healthy and live a healthier lifestyle and have those habits.
So we came up with a currency that was based completely on health and rewarding activities such as exercising and making food diaries and things like that, so that we could actually make health something as sought after as wealth.
Hi, my name is Dr. Mary Oates. I'm a physical medicine and rehabilitation doctor. Obesity is a burden that has many different effects on all generations and all aspects of life. Obesity is actually the root cause of many of the medical illnesses that I treat in patients. For example, obesity causes diabetes, it can cause kidney failure, it can cause terrible arthritis in the hips, in low back, in knees. And so if we fix the root cause of obesity, we can actually improve the outcome and treatment for all of these other issues.
Obesity's harmful effects have been more clearly monitored in recent years in terms of its prevalence in both developed and underdeveloped countries. Worldwide obesity has nearly doubled since 1980, and 65% of the world's population live in countries where obesity kills more people than malnourishment. Obesity has reached epidemic status, killing 2.8 million people a year due to complications following development of obesity. The American Medical Association officially classified obesity as a disease in 2013.
I'm Dr. Peggy Papathakis, and I teach at Cal Poly. I specialize in global nutrition or nutrition in developing countries primarily. So the nutrition transition is what that's called. And I just spent the winter quarter in Malawi, which is a little country that's in southern Africa. And they are definitely experiencing the nutrition transition, as is China, Japan, many countries in South America, a lot of Africa. And what I call it is the worst of both worlds. So you have the developed world and the developing world. And they've got a situation that it's really the worst of both situations. And I say that because they still have lots of poverty and lots of undernutrition. So people are still dying from malnutrition related diseases. But at the same time, there's some prosperity, much more sedentary behaviors, and then they have lots of access to all the foods that are really high fat, ones that are associated with calorie density. So people are eating now too many calories there and not exercising enough. So they're having the same diseases that we in the Western world have been combating for probably 40 years now.
An important resource and stakeholder in the battle against malnourishment, particularly obesity, is the World Health Organization. Currently, the WHO is attempting to reduce the prevalence of obesity around the world and recently created their process to solving the global obesity epidemic. Unfortunately, it lacks any substance. The plan merely urges member states to collaborate with the WHO in developing a global strategy on diet, physical activity, and health. The plan itself does not give strong initiatives but remains vague and unclear. Our goal is to create a separate board on the WHO, and through this board we would launch our currency titled Fitcoin.
So we wanted our currency to be a reward for people who were making good behavioral choices that supported a really healthy, active lifestyle. And these kind of behavioral choices would include, being aware of calorie intake and reducing portion sizes and exercising regularly. Those are the kinds of things that we thought a healthy lifestyle should include.
We call our currency Fitcoin. Fitcoin's not necessarily a tangible currency, but it is instead tracked by a series of points through a reward system.
So the reward system would reward people for specific tasks or setting goals and reaching those specific goals over a set period of time. And so once they reach those goals, they get certain rewards.
So we tried to quantify Fitcoin. So the most basic would be if you burn 250 calories or walk 2,000 steps, and that's 1 Fitcoin. And then the next level up would be joining a gym, and that's 10 Fitcoins. And then participating in a sports team, like a league, would be 75 Fitcoins.
And we also thought that it could be possible for participants to track their progress at home in things like food logins or exercise diaries. And then through yearly or monthly or semi-annually annual checkups, doctors or dietitians, especially those employed through Medicare to help obese patients, could monitor the weight loss and the progress of the participants who were using the Fitcoins and being rewarded for having these healthy lifestyles.
Once we decided on the general basis of our currency, we proposed our solution to Peggy, who told us about a similar program being administered in South Africa.
So I was really thrilled to hear about your proposed, I'll call it, intervention. And when I heard about it, it reminded me of one that is being used in South Africa. Said in this new program, they're really trying to promote healthy behaviors. Every single person visited with a registered dietitian and went through their diet. Whether they were overweight, underweight, it didn't matter. The idea was to improve how that person ate food and to improve the quality of everybody's diet. And you would put in your 24-hour recall or 3-day food record of what you ate. And then if you were fulfilling the behaviors that were set up for you, then you got credit for that again. And so eventually, at the end of the month, first you had to get X number of little check marks. And once you hit that, then every month, as long as you sustained that, you would get vouchers that you could use at the grocery store. But those would not be to buy chips and candy bars or beer and soda. It would be to buy fresh fruits and vegetables.
Every component of our program is designed to inspire a healthy style of living, from the Fitcoins earned to the reward system.
So this program was designed to motivate, educate, and also improve availability to fresh food.
So for example, with your Fitcoins, you can get certain rewards like credit for fresh produce at farmers markets or grocery stores, a bicycle, or if you have a lot, you can get exercise equipment, dumbbells, stuff like that.
And once people start accumulating a lot of these Fitcoins, we were thinking an amazing opportunity to help the people that are struggling with malnutrition in developing nations would be to donate some of these accumulated points to the people in those developing countries.
Malnutrition is a double-edged sword, and although 65% of the world's population live in countries where being overweight kills more people than being underweight, undernutrition is still a serious issue in many developing nations. Areas such as Africa battle AIDS, food scarcity, and water scarcity. Because our currency requires an administration, food providers, and an organization that many developing nations cannot provide, we propose that a portion of the currency that participants in the program gain be rewarded to others in developing nations. Once participants reach a certain level of Fitcoins, the administration that was providing them would require a portion of them to be donated or given back in order to support healthy lifestyles globally. We We admit that such a proposal may seem difficult to implement at first, especially because farmers and other suppliers may not be willing to exchange their goods for such a currency. However, private insurance companies and large employers would financially support such a program because it could lower the overall cost of healthcare for those they insure. Thus, the support from these companies could provide the financial backing needed to start and maintain such a currency.
This is simply the first rung on a tall ladder leading to a comprehensive solution for our obesity epidemic. It's a starting point for a global system of wealth for health that could not only benefit any number of people on an individual level, but also provide the necessary components to create a culture that emphasizes healthy lifestyles. It needs to advance from a system to a mindset. The paradigm need only spread to our minds, in addition to our bodies, for it to truly take complete and lasting effect. Our currency must not only create a system for healthy living and instill motive, but also alter lifestyles. It must become habit. We propose that health is wealth, and health is humans' most treasured currency.